Hello, this is Smita Kumar, and you're watching Healthcare Startup series at Medicircle. As usual, we have yet another guest today, Dr. Niklesh R. Shah with us. He's the co-founder and CEO of Pret Health, which is based out of Mumbai. Pret Health enables integrated care management and provides smart solutions to hospitals, diagnostic centers, and doctors, along with the ability to securely plug into the larger ecosystems that would be actually helping these hospitals and healthcare providers in many ways, reducing the cost, time, and carbon footprint for all the interactions and transactions among key stakeholders of the healthcare ecosystem. Hi, Dr. Nilesh. Welcome to Medicircle.
Thank you, Smita. Thank you for that generous introduction. I think your elevator pitch was just fine.
So, as you are based out of Mumbai, tell us when and the idea started that you should be starting something like Pret Health. What was the reason behind it, and how things progressed?
Yeah, I think the idea more or less started about a year or so back when we came across the opportunity to coordinate care, especially for cancer care patients, because we realized that it's a very, very fragmented service model, right? And today, when you are suffering from cancer, the patient also has a lot of other caregivers that are involved in the care, and everybody's trying to do their bit, but it's very difficult to get everything in one place. And so that was sort of one thought process that we had. The second was also clinical data still resides in so many different places, right? You have data with the doctor, you have data with your diagnostic centers, and COVID did a little bit good in terms of enabling everybody electronically to at least share those PDF reports, but they're still PDF reports, right? There's no one place that you can go to access all that data, and more importantly, even share that data with other people. So the idea was to really focus on the ecosystem rather than building individual solutions, which there are a lot of companies that do that as well. Our intent is to really connect all of these disparate data sources.
Definitely, if I'll just share one fact here that less than 5% of the healthcare data is collected in India. And a survey conducted by the National Sample Survey Office in 2014 found that it was found that only 72% of the rural and 79% of the urban population obtain their treatment from private hospitals. And there is little to no data reported from these sources, especially when we talk about the clinical information that needs to be accessed by different healthcare stakeholders to provide better care plan to the patient. So as you started just a year back, so what are your prime USPs over other startups who are also trying to segregate and comprehensive this data, especially for the oncologic hospitals, and provide them a source so that the treatment can be made faster?
Yeah, I think our key USP is really the ecosystem focus, like I said, right? At a very basic level, the platform is a cloud-based technology that is focused on cancer care, like I said, but it has the ability to efficiently manage a lot of complex clinical data. Right? What I mean by that is not just the medical information that is part of your history, but also all the diagnostic data, your lab values, your not just your diagnostic reports, but even your films, right? CT scan, MRI, X-rays, the digital images. And that allows us to do two or three things, right? One, having all of that data in one place that can be accessed both by the patient and the doctor makes it very convenient, also reduces time to start all over again, right? Oftentimes you don't have your files, patient lose medical records, and so you have to go over again. You probably have to repeat some diagnostic tests. So all of that can be avoided, right? That's number one. Number two, I think the ability to share the data electronically with anybody around the world is a great benefit, especially when it comes to cancer, because it's very common for people to take more than one opinion, right? People just want to be sure it's it's a life-saving thing for many people. And so you typically, and also, like I said earlier, there are many caregivers that are involved that could also be geographically dispersed, right? Often the person who's suffering from cancer is in one city, their son, daughter-in-law, son-in-law are the primary caregivers. They are in another city. They want to be able to sort of make sure that, yeah, they are getting the right treatment. So our platform allows that very, very easily, right? You just need a phone number and you can share that data with a link to anybody you choose to, and still the patient has consent rights, right, to decide who has access to the data. And then third, what we've also introduced now is a service model to complement the product, right? What I mean by that is that patients have an app where they can request home care, nutrition counseling, a lot of these things which are important and oftentimes neglected in the care because everybody is so overworked that the doctor can only do so much, right? And then the patient doesn't have any easy way to get quality services that are really required and can affect what their prognosis might be. So our ability to actually bring all of that together for our patients also separates us from the from the rest of the competitors. And we have had the benefit or fortune of being associated with the cancer care hospital. So having access to those cancer care specialists also allows us to build something that is vetted by the clinical people, right? Which is often the issue with a lot of healthcare softwares, that the utilization is low because the development was done by somebody who was a non-medical person, right, and didn't truly understand what the workflow is of a doctor, which is fairly unique.
But as we also have this ABDM, that's Akhil Bharatiya Digital Mission, that is also trying to segregate information from different healthcare providers and provide an access to the digital patients so that the records can be shared in a hassle-free method and can be accessed, that all these health records can be accessed digitally. So, but again, as we talk about adoption of ABDM compliance is also not especially there in these healthcare providers, and we have a lot of HIS systems and diagnostics and lab systems who are still not compliant, and they have yet not started creating IDs and other things with which the integration can become helpful. So, one of the prime USPs being giving them this access through a mobile number kind of a thing, which would be really easy. But tell us, how does it exactly works for a patient who's a cancer patient and who wants to share the information with other care providers and the family members also?
Yeah, and I'll also add a little bit to your ABDM comment, right? That we are actually very excited with that because that gives a lot of impetus to digitizing the healthcare data, right? Like you said, a lot of challenges at some point they will be overcome. But I do think that companies like ours will be what I call as the last mile builder, right? That the government will provide the infrastructure at scale. They won't have the muscle or appetite to go to each hospital or each center and try to figure out how they're going to connect, because somebody still has to pay for all of this, right? To push and pull data. And so companies like us, we believe, will be sort of in the middle, right? Between the folks who hold the data and want to participate, but need a better ecosystem to sort of connect to, and we can connect with the NDHM infrastructure. So we are preparing ourselves to ensure that we are ready by the time that gets rolled out. So we don't really look at that as competition. We actually feel that that'll be very complementary to what we are doing.
But isn't it a parallel platform that you're trying to build up? So once in there and there is a sandbox compliant with all these things, don't you think the hospitals won't be requiring such a service?
No, it is a parallel platform, but I also think that while the public health infrastructure, the government hospitals, to some extent can be mandated, right, to use the government infrastructure, it is still uncertain on what will happen on the private side, because a lot of the private hospitals don't get much revenue from ABDM patients yet. So I think that remains to be seen, which is why I feel that on the private side, we can be sort of that glue, right, that can connect them to the overall healthcare infrastructure. And even on the public side, I think a lot of the softwares that are currently being used are very antiquated. So whether that integration capability is there, not there, somebody will have to evaluate that. And we are hoping that gives us the right sort of landing place, right, to start building some of these things at scale. But to answer your second question in terms of what does a patient get, right? And so let's say if you're a cancer patient today and you came to one of our centers, right? All of your OPD data, the doctor's prescription is immediately available to you on the app, right? Now, typically for a cancer patient, the doctor is likely going to prescribe you some lab tests and CT scan, likely a PET scan. With all the diagnostic centers that we are integrated with, as soon as your scan is done, that report and the image is electronically uploaded on our platform, right? We are directly integrated with the devices. So before the patient actually even gets the report, the doctor already has it. And so it speeds up the care process. But more importantly, over time, we actually feel that the patient doesn't have to even move around with those big black films, right? Which you just is lying somewhere else in the house and you never look at them again. So that is the second part. Now, when they get admitted, if they, God forbid, need a surgery, all of their IPD data, everything is on our platform. And then after they are discharged, we have, like I said, we've introduced a lot of the services that help us coordinate everything that they need post-operative. And typically, these surgical patients need home care. They need some nutrition counseling. Protein intake is very important in the early days. A lot of them, where there are genetic disorders, we encourage them to make sure that the siblings are getting tested. So a bunch of these kinds of things that require some follow-up, right? The doctor may say that at discharge, but you have so much going on that, and you don't have the convenience. So that is also the idea that we can then continue in terms of being involved outside of the hospital setting to coordinate the care of the patient all the way through end of life, right? Which is very common in a lot of cancer patients today.
So in this 1 year of time, how many patients' lives you have touched so far, and what kind of response you're getting, especially if they are getting each and every record digital available. So what's the
Yeah.
response?
So over the last year or so, our total database has about 5 lakh patients who have at least one data point with us, right? It could just be one lab report, one X-ray, one CT scan. But what matters to us really is cancer patients, right? So as of now, as of the latest count, we have 12,000 plus cancer patients that are registered with us who have more significant amount of data. So not only are the lab tests available with us, but doctors' prescriptions, their medical history. So that's the pie that we really want to grow. While the 5 lakh number looks very large, but since we are focused on cancer care, and it's a good enough number, I think we just launched our app last month. So right now our focus really is on making sure that the patients are educated about the app, they find it to be user friendly, we can assure them of the quality of our services. That's really the current focus as we expand the patient base.
And one very important question out there. So, are they getting a chatbot or a robot to answer, or your support system is that good enough? See, again, we are having so many apps that these HIS companies and even these data companies provide today. But what they're actually looking is a hand holding. So, is Spread Health able in a condition to actually handhold these cancer patients, which they are definitely looking for this data to be stored at one place and accessed digitally so that the doctors can also timely give their suggestions. But at the same time, as you said, the doctor may tell them for further reports or diagnostics, but they need to be reminded, and there has to be some support that is required. So, what is your take on that, and how are you managing that?
Yeah, no, that's an excellent question. And like you rightly said, that people want that human touch, right? While the robot may be fine in terms of what it throws out, but they just need validation. You need reassurance, especially when you're sort of a little bit down, right, mentally. So no, we do have a framework where if a patient has a question, despite all the services being available on the app, they can quickly fill out a form, and somebody on our side is able to then put them in touch with the right person. Sometimes it is the doctor, but we also have this concept of patient care coordinators that are often the folks that can at least address most of the basic questions that don't need to go to a doctor. And the idea is really to do that so that they feel that they are able to get somebody to talk to and get answers to their questions. But at the same time, the doctors are too busy, right? And they would never get to it. And so we are trying to filter out what kind of information goes to whom. But like you rightly said, that we do need to have a service model that has a human touch to it when needed.
Definitely, if we have a very, the patient doctor ratio is very, very abysmal in India. Definitely, the doctors who are actually treating these patients, so they are very few in numbers. But as the burden of cancer is increasing in India, we definitely need such people who can actually help these surgeons, especially oncosurgeons, who are the busiest of them, because again they have to perform surgeries, and again this is the treatment plan also goes for a long time. So again, we need experts and professionals who can handle the calls of the patients and also satisfy them with the queries, with the answers they are having. Moving on to my next question, Dr. Nikesh, that you have set some goals for the next year or 2 or 3 years. So what are them? And as you're based out of Mumbai, what are your future expansion plans, and which territories are you planning to expand?
Sure. So I think as far as from a business goal standpoint, I'll answer that question in 2 or 3 parts. That one is the core product, right? The technology itself. And in that, we have sort of 3 parts to it, right? One is the patient app itself. We want to continue to expand our services on the app, make sure that everything that's relevant to a cancer patient is available to them, and it's convenient geographically as well, right? We don't want somebody who's staying at one place, have to travel, then the purpose is defeated, right? So we want to expand our services footprint so that locally it is convenient and all of your needs are met. So that's number one. I think on the diagnostic side, we really want to embed some artificial intelligence to read images, detect cancer, even when they're early signs, right? And so a lot of radiology centers have expressed a lot of interest that if that is available, they would be very interested to expand on our platform. And the third, our platform is also used for running the hospital, right? The cancer hospital. And we want to include the medical oncology protocol. So chemotherapy these days is getting more and more complex. A lot of new drug regimens are being introduced, and the doctors are finding it very difficult to keep up with that level of science and having to remember everything, right? Dosing calculators. And so we are going to expand our product to incorporate all of that as well. So that's the product side of it. On the customer side, like I said, for the patients, we want to ensure that they have an excellent experience on the app, and organically they are able to refer other cancer patients, right? So we just want to grow that footprint as we get more and more patients registered on our platform. And similarly, we are also expanding our footprint on the hospitals and diagnostic centers. Some of our hospitals, they are already expanding geographically outside of Mumbai, right now in Maharashtra and in other states. And so our intent is to, sort of generally expand with them. But at the same time, we've got a lot of inbound interest from other parts of the country, right? And the good part about this technology is that I don't need to be physically present anywhere, right? They just need to subscribe to the platform, and we just have to then go and locally make sure that whichever are the diagnostic partners that they are using, we are able to integrate with them and create what I call as a micro ecosystem, right? So the moment we get a hospital as a customer, we are able to then create the ecosystem for them around them, because most of these are outsourced partners, right? They may not have their own lab or own radiology center or own pharmacy. We are able to bring all of that data for them together and then extend it to all of the patients that they are serving. So that's really more or less the plan over the next year or so. In addition to, like we discussed, being ready with the NDHM ABDM infrastructure to plug in.
And as it's just been a year, but definitely you might have learned some lessons, some in a hard way or some in a very easy way. So would you like to share any experience that you had during your starting days, which you would like to share with the fellow entrepreneurs on Medicircle?
Sure. So you always get a lot of no's, right? That you're looking for investment, and you are very convinced about what you're trying to do, and oftentimes you'll get a lot of rejection, right? And rejection in any form is hard to handle, especially when you're so confident. And so I think the one advice that I would like to give is that you just have to assume that there will be ups and downs, both the market ups and downs as we are seeing right now, but also personal ups and downs, right? There are good days, there are very good days, and there are really bad days too, that you met 3 people and everybody just plugged holes into your thinking. And I think related to that, I would say that collect as much feedback as possible, because oftentimes, especially from critics, right, they might uncover some unaddressed pain points that you can build, to plug into. And so I find that feedback to be very, very valuable once you get over, like, oh, they said no to me. But I think that patience and persistence, right, that goes hand in hand when you're running a startup.
Definitely. And for all startups, I think they have, at any point of their life, they would have definitely witnessed or encountered with this line that we would like to pass on this opportunity, especially from the investors when they are approaching them for funding. And it's so confusing for a founder that he or she is actually not told about the reason. And there are some very, very things, there are a lot of things that happen, but still the founder is not sure about. But again, in that case also, they need to follow their dreams and they need to believe that definitely they are going to achieve success someday. So that's really commendable, and hats off to this this feeling of and having something to continue with, because you need to believe in what you are doing today, what you're building today. Thank you so much, Dr. Nikesh, for joining us today at Medicircle Healthcare Startup Series. Wish you and we wish you and your startup, Predcare, all the best, so that it actually, gives more and more power to especially cancer patients. They are definitely looking for such solutions, because again, like Pred Health, it is now based in Mumbai. Would definitely wish that it's there in each and every remote pin of India, so that the data which is really not digitalized. We are actually planning to have data in digilockers or in a certain location, but it is still in PDF files. Even that milestone has not yet been achieved. So we cannot actually assume or think of having analyzation of data for this cancer patients. Definitely it can, if it is baked, it can give actually very good results for other treatments and other plans, which is not happening today. But yes, nevertheless, it's a first step towards success. Thank you so much once again for joining.
Thank you, Smita, for having me and giving this wonderful platform to express what we are doing with passion and pride. So thank you.